Good morning and good afternoon, everyone. My name is June. I will be your moderator for today. It is my pleasure to welcoming you to the webinar of Medicine Use for Women's and Men's Health in Asia. So now I would like to introduce our speaker, Ms. Monica Lay. She is Regional API Product Specialist of Human Well Healthcare. So please welcome Ms. Monica.
Hi guys, this is Monica from Hubei Gedian Human Well Pharmaceutical. I'm your host today, and I'd like to have a discussion with you on the better medicine use for women and men's health in Asia. In today's discussion, there are 4 parts of content. Begin with the background figures of the current market of sexual and reproductive health. Then we'll mainly focus on women and men's health regarding their drugs and application. At last, I want to give you a brief introduction of our company, Human Well Pharma. Okay, so start with background figures. The global population is keep rising. Discovered by the UN, there are almost 2 billion increase within 30 years from now to 2050. And the world is facing a common issue, getting old. As you can see, the world population age rate will almost double in 2050 at estimated 16%. So the world contraceptive market value has huge potential to reach 33.6 billion by 2023. And in some countries like in India, Indonesia, Thailand, or Africa, they are facing problem of having increasing birth rate, while in others, like for example, especially in developed country, they have pressure of declining birth rate. And so we could say that the market value is really, really huge, as the screen shows that the market value will reach about 31 million in 2023. And also the world infertility drugs market will have 4.2 billion by 2020, also is estimated. And in APEC area, the infertility service market is 4.52 billion in 2020, while increased to 20.49 billion to 2030. As you can see, it is clear that just in 10 years, there will be almost 5 times market value growth. And now to women's health, I want to now moving to the next section, women's health. In this section, the application of drugs in women's health will be categorized into 4 parts. You will be illustrated about different types of contraceptive methods, including short-acting and long-acting and abortion, and also different types of illness of reproductive, like endometriosis and postpartum depression, and also menopausal syndrome and breast cancer will be discussed in the following section. And so I want to begin with the contraceptive devices. In contraception methods, besides condom and sterilization, taking steroid drugs is the most common way for contraception. According to their character, They could be categorized into emergency pills, short-acting contraceptives, and long-acting contraceptives, and also abortion. I want to focus on long-acting contraceptives today. It's also called long-acting reversible contraceptives, LARC. It provides effective contraception for an extended period without requiring user action, including injections, intrauterine devices, and subdermal contraceptive implants. So due to their various advantages, like the 1% failure rate and no reliance on patients' compliance, they are the priority choices for women, especially for those adolescents and women who in lactation or has uterine malformation. And the most common drugs and devices for long-acting contraceptives are medroxyprogesterone acetate injection, and also levonorgestrel implants and entonogestrel implants. Next, moving to reproductive health. The common illness of reproductive, including miscarriage prevention, assisted reproductive technology, and EMT, also postpartum hemorrhage, also called postpartum bleeding, and postpartum depression. So let's look at miscarriage prevention first. Using progesterone series drugs are the most common way of the treatment in miscarriage prevention, including oral soft capsules, gels, and injection forms. The benefits of progesterone is because it's an endogenous steroid which generates from glands or cells in the body, and therefore they have less side effects on woman's body. While dydrogesterone tablets are another common use for miscarriage prevention. And I would also like to focus on endometriosis, also called EMT. There is no actual cure for EMT, but a number of treatments may improve symptoms, which including hormone therapy. For example, Dinogest tablets, which credit to its pharmacological advantages of natural and synthesis progesterone and its high bioavailability. As you can see, other illnesses like PPH and PPD are also illustrated on the screen with their common use drugs. For example, for PPH, we had carboplatin injection. Okay, now let's move to menopause. There are two mainly illnesses related to menopause. The first is menopausal syndrome, also called we always use estrogen replacement therapy. And another is menopausal generated osteoporosis. For menopausal syndrome, it's a common syndrome that will happen on every woman, usually between their age of between 40 to 60, and estrogen replacement therapy is a common treatment for menopausal syndrome, usually by taking estradiol progesterone capsule or estradiol valerate tablets. As an estrogen, estradiol belongs to endogenous steroids, like progesterone we have talked about. It will occur less side effects on female patients. And other steroid therapeutics like tablets, estradiol gels, or medroxyprogesterone acetate tablets could also be found as the treatment for menopausal syndrome. And moving to cancer, I want to focus on breast cancer, which is the most concern problem that happens on women, accounting for like 25% of cancer in all cases that happens on women, and it is more common in developed countries, we could say that. So GnRH series drugs are more common as the treatments for breast cancer. For example, goserelin. It is strictly a natural GnRH decapeptide with 2 substitutions to inhibit radiate degradation. The benefits of taking it for breast cancer, including low-cost treatment and conducive to protect ovarian function and has less severe side effects. Okay, far from now is all the contents about drugs application in women's fields. Now let's jumping into men's health fields. In the following section, we will focus on men's health and have some discussion through reproductive assistance and prostate illness, including the illness that men cares the most in the world, like erectile dysfunction and premature ejections and OAB, overactive bladders, and BPH. And we'll also introduce you a new published drug, TG Angels. Start with reproductive assistance. Even the rest of 3 illnesses are a big concern in men's fields. I want to focus on erectile dysfunction because this is the most concerned part that men care a lot in the world. So the common treatments are including sildenafil, vardenafil, and I want to have a look on tadalafil. It is famous by its long effective time and no time limited in taking medicines. And also its onset time is typically within half an hour and the duration is up to 36 hours, not like other drugs like sildenafil. Well, other drugs like avanafil, vardenafil, sildenafil are also common for treating erectile dysfunction. Next, let's look into prostate disease. As the table shows, there are 3 main issues in prostate disease. Begin with benign prostatic hyperplasia, BPH, also called prostatic enlargement. It is a non-cancerous increase in the size of prostate glands. Symptoms may include frequent urination, trouble starting to urinate, and weak stream, and inability to urinate or loss of bladder control. And the complications could include urinating tract infections and bladder stones, and also chronic kidney problems. And about 100 million men are affected of BPH, and among them, half of males age 50 and over are affected for sure. After the men aged of 80 and above, about 90% of male are affected. The representative drugs are finasteride and dutasteride. Both these two are 5-alpha reductase inhibitors. The mechanism of 5-alpha reductase inhibitors is to inhibit the conversion of testosterone to dihydrotestosterone by 5-alpha reductase, thereby to reduce the level of dihydrotestosterone in the prostate and the volume of the prostate. Also to relieve the statistic factors of BPH and improve the clinical symptom. Also, I'd like to have a look on prostate cancer. For prostate cancer, it may initially cause no symptoms, but in later stages, symptoms include pain or difficulty urinating or blood in urinate and the pain in the pelvis of back. The symptoms may similar to those caused by BPH. One common treating drug is abiraterone acetate. It's an androgen biosynthesis inhibitor. It improves overall survival in patients with metastatic castration-resistant prostate cancer after they having chemotherapy. And abiraterone doesn't cure prostate cancer for sure, but it do helps to keep it under control and also could help to treat or delay symptoms for patients such as pain and tiredness. Therefore, to improve the quality of the life of the patients and with relative low costs of treatment compared to other drugs. Okay, now we will have a look into the new published drug, which may satisfy more than one benefit at the same time. Current contraceptive methods come with a number of drawbacks, including low efficiency in the case of commercial contraceptive gels and a reduction in the quality of sexual intercourse in the case of condoms. Adding pharmacological active agents to contraceptive gels holds the potential to improve sexual experience and hygiene and also to make sure erection safety. So here comes the new drug, TGN gel. It's a carbomer-based contraceptive gel consisting of 3 agents: tenofovir, gossypol acetate, and the nitroglycerin. With the pH adjusted to 4.5 by the developer in order to be compatible with the vagina. TGN gel is researched and developed by the team led by Professor Chen Ke. It is designed and produced to simultaneously satisfy 3 functions, including contraception, preventing of sexual transmitted disease, and also to improving male libido and erection. The gossypol acetate component of the contraceptive gel proved to be a significantly effective spermicide. In addition, tenofovir in the gel is significantly inhibited lentiviral transfection efficiency in the cell-containing media. So combining 3 FDA-approved and market agents with the benefits of preventing sexual transmitted disease and also improving males' erection function during sexual intercourse, TGN gel has a great potential for further translation and further commercialization in the future. After the illustration of drug application from men and women's health, I want to provide a short introduction about our company under the lead of Human Well Healthcare Group. Human Well Healthcare Group is a corporate who deeply roots itself in global healthcare industry and also being a sincere partner to our customers for 28 years. Human Well is a leading enterprise in the pharmaceutical industry in Hubei province, one of the top 20 pharmaceutical industry in China. Human Well Group was founded in 1993 and later listed on Shanghai Stock Exchange in 1997, with the headquarters in the center of China, Wuhan. Human Well operates and serves its customers in over 50 countries and districts for over 28 years. And as the screen shows, after Human Well went public in 1997, Human Well keeps expanding its business layout and scaling up its capital. Human Well booked around 90 billion years in a recent year and will keep growing in the future years. As you can see, the history of Human Well Pharmaceutical. In 2009, Human Well Pharmaceutical established PureCap Pharma in US, and also in 2021, Gedian Human Well and Xinjiang Yizhi Pharma and Yichang Human Well were also established. Human Well focus on market segments with high barriers and strives to be the leader in every segment it enters. At the same time, Human Well integrates the industry from supplying APIs and excipients to finished dosages, including research and develop stages to multi-channel distribution, which covers chain stores, e-commerce, pharmacy, and hospitals. Now, Human Well Pharma is the leader in anesthetic and also fertility regulation drugs and Uyghur medicines in Asia. As the subsidiary of Human Well Group, Hubei Gedian Human Well is a fruitful pharmaceutical company engaged in research and developing and manufacturing and marketing of steroids API, also intermediates and reproductive health medicines. Here are some photos of our company, including our sites and office. We located in Hubei province, Gedian. So our name is Hubei Gedian Human Well Pharmaceutical. In addition, we are the biggest manufacturer of progesterone and finasteride and also budesonide in China. Gedian Human Well are well-qualified manufacturer who get approved by US FDA, as you can see, and also DQM and PMDA and also TGA. The list of our products shows the huge potential of our company. And we also have stable cooperation with both local pharmaceuticals and international corporates. For example, you can see our star items, progesterone. It's a progestogen steroid. And also mifepristone and tibolone are also well sold in recent years. Not only sex steroids, also corticosteroid steroids like budesonide and the methylprednisolone could also be found on our list. So now Human Well is still and will continue to devote itself to the pharmaceutical industry for improving global healthcare by providing our customers the higher quality and the most comprehensive healthcare products and solutions. And thank you for all the attentions of today's discussion. May you have a good and better day. Thank you.
Thank you very much, Ms. Monica. And on behalf of the organizer, I would like to once again thank you everyone and speakers for today. So before the webinar ends, we also have another topic on the CPHI Southeast Asia Digital event from today until 10th of December. So please stay tuned with us to gain more knowledge and insight in pharmaceutical industry. Thank you and have a good day, everyone. Thank you.
Thank you, Sure.